Hi, I'm Cherie Ruffo, President and CEO of Chrysalis Environmental Services. Karen Messier, my co-founder and business partner at Chrysalis, and I got involved in needle disposal in 1999 when Rhode Island Resource Recovery Corporation reached out to us for help. Improperly disposed of needles were showing up on the recycling lines at their facility, endangering workers. Each year, over 10 billion sharps are used in the United States, and over 90% of them are improperly disposed of, creating a hazardous situation. They're put in the trash, they're flushed down the toilet, they're even dropped on the streets. In your community, young children and pets who don't understand the danger of a dirty needle are at risk every day. Recently, a study was conducted on children, and it was found that most injuries occurred on public streets and parks. And in the majority of the cases, the children intentionally picked up the needle. These dangers pose a risk to every community worldwide. According to the Food and Drug Administration, approximately 850,000 people receive needle stick injuries outside of healthcare systems each year. That means outside of hospitals, doctors' offices, and medical buildings. When we talk about the dangers of loose needles in the community, we associate them with children, pets, and residents. But the truth is they pose an extreme risk to municipal workers too. When a person is stuck with a used needle, not only do they go through the agony of a 6-month wait to find out if they've contracted HIV, but it costs close to $10,000 in treatment and missed time from work. The total cost for local municipalities annually is over $850 million nationwide. But the important point here is that municipal workers, police officers, fire and rescue crews, and parks and recreation workers are not safe. Loose needles often go unrecognized and create a great risk in the community. What happens when a person receives a needle stick injury? The biggest problem is that there's no way to know where the needle came from or what it was used for. Communicable diseases such as HIV can live up to 72 hours on a needle, and hepatitis C can live up to 2 weeks. That is far too great a risk to leave these needles in the community. Why hasn't something been done about a problem this big? Currently, there are no national regulations in place for sharps disposal. Some states have initiated their own. Mostly, communities have gotten together to create their own program and have seen great success in the reduction of used needles in their communities. And this problem is still growing. In the past couple of years, we have seen the overdose rate in the United States increase by 40%. 40%! These are not small numbers. 25% of these overdoses can be attributed to an injectable, heroin. I know you work with overdose cases all the time, but to give you an idea of how bad it has gotten in the nation as a whole, I have some statistics. In 2002, there were 2,000 heroin deaths in the United States. By 2013, that number rose to 8,000. By the end of 2014, the numbers skyrocketed. There were 50,000 overdose deaths, 31,000 from heroin. That's a staggering increase. We have to work together to solve this problem. The numbers continue to escalate, and action needs to be taken on all fronts to address the problem of access to used needles. So back in 1999, when the Rhode Island Resource Recovery Corporation approached the Diabetes Foundation about the used needles showing up on the recycling lines, they did so because they knew that over 50% of the needles were coming from people with diabetes. Over the first 9 months of 1999, the Rhode Island Resource Recovery Corporation experienced a 40% increase of loose needles on the recycling lines, 6 worker needle stick injuries, and $120,000 lost production time due to shutdowns. In addition, each needle stick injury cost $6,400, totaling $38,400. Their problem was escalating, and their worker morale and productivity was dropping due to the fear of loose needles. Karen and I began to research this issue, and we found it a huge problem in every community. We kept asking the question, why has nothing been done about this? We found that many communities had started programs and they died political deaths due to over-stringent regulations. So we partnered with the Rhode Island Resource Recovery Corporation, the state of Rhode Island, Stericycle, and Waste Management to create Eureka, a needle disposal project. In 2002, the Eureka program became a model program for the Environmental Protection Agency. But before I tell you about the program, let's return for a moment and take a look at what happened at Rhode Island Resource Recovery Corporation the first year of the program. They experienced a 100% reduction in worker injuries. There wasn't a single needle stick injury. Loose needles found on the lines were reduced by 50%. That meant a 50% reduction in financial losses. But most importantly, there was a significant improvement in worker morale. The most valuable lessons that we learned in those first years were that we needed a program that was anonymous, easily accessible, and free or low cost to the community. In the first year and the following years, needle collection for the smallest state, Rhode Island, was approximately 1 million needles per year. That's right, 1 million needles that would never reach the landfill. They were collected, heated at high temperatures, cut up to be unrecognizable, and burned for energy. Those needles would never be a danger in the community again. By 2006, the program had grown, and many other communities wanted to start sharps disposal programs. So Karen and I left the Diabetes Foundation and started Chrysalis with a couple of other business partners. Jake Jacobs, who has several decades of experience in the medical waste field, would join us at a later date to lend us his unique expertise. So what have we created? A sustainable solution to the sharps epidemic. We call it the Zeedle.
Operating the kiosk is very simple. First, be sure to use the proper sharps container. Your first option is to use a store-bought container purchased at your local pharmacy. Another option is to use a puncture-resistant, non-see-through container such as a laundry or bleach bottle. You can use a bottle up to 1 gallon in size. You may also use a tape-sealed coffee can. Please be sure to tape the lid to keep the needles safely contained. If you have more than one container, please drop each one in separately to prevent the opening from jamming. The sharps containers fall into an interior corrugated box lined with a special biohazard red bag liner. When the kiosk is full, the waste hauler will remove the box and replace it with a new box and liner. The waste will then be shredded and burned at a very high temperature.
I'm looking forward to working with you to make your community a safer place. See you soon.